Welcome to 3K&D Health Yarn with the North Eastern Public Health Unit, or NEPHU. I would like to acknowledge that this program was recorded on the stolen lands of the Wurundjeri people of the Kulin Nation, and would like to pay my respect to elders past and presently listening and those emerging. Sovereignty was never ceded, always was, always will be Aboriginal land. The podcast today will be in regards to diphtheria, and I'll be joined in studio by Dr. Jenny Royle from VACCHO and Dr. Caire Gordon from NEPHU. Okay, so today's health yarn is on diphtheria, and in the studio I've got with me Doctors Jenny Royle and Dr. Caire Gordon. How you doing?
Good, thanks, Josh.
That's good.
It's great to be here.
Yeah, if you wouldn't mind, just give us a bit more information about you guys and your background, your organisations, maybe.
So I'm Dr. Caire Gordon. I work at the North Eastern Public Health Unit, and I'm an infectious diseases and a public health doctor.
I'm Dr. Jenny. I work at VACCHO, Victorian Aboriginal Community Controlled Health Organisation. I'm a public health advisor, and my background is a immunisation paediatrician.
Okay, wonderful. Thanks for being here today.
Thanks for having us.
All right, well, I guess let's just start things off basically. What actually is diphtheria?
So diphtheria is a bacterial illness, and it causes symptoms depending on the location of where the infection is. So it can infect the throat and cause throat diphtheria, or it can infect the skin and cause skin diphtheria.
Okay.
So we mostly see skin diphtheria. It occurs in about 2/3 of the people who have diphtheria, and it is a skin sore or an infected wound or a cut that takes a long time to heal.
Okay.
So with throat diphtheria or respiratory diphtheria, it starts off with a sore throat, fevers, or a swollen glands in the neck. And then for people who have been vaccinated and they're up to date with all their boosters, it normally just stops there. But in people who haven't been vaccinated against diphtheria, or maybe it's been a long time since they've had a booster dose, they can develop a more severe illness.
Okay.
They develop a thick whitish grey membrane at the back of their throat, which can make it difficult for them to swallow and to breathe. But we really only see that very rarely these days,
Okay.
because nearly everyone's vaccinated against diphtheria.
Okay, great. Did you have anything to say on that, Jenny?
Yeah, I guess what we're doing in Victoria is we're kind of preparing for the possibility that diphtheria might start occurring in Victoria. At the moment it's occurring in other areas of Australia, so most people locally probably haven't even heard of diphtheria, even though diphtheria is a bacteria that we've got a good vaccine for, and we give it routinely in our schedule. So when we go and get a whooping cough or tetanus booster, it's actually included in that same
Okay.
good vaccine. So many of us have had our vaccines on time as an infant and child, but it may be quite a while since we've had actually a booster dose, and that's why it's good to sort of have a chat about it now, because we might think we're protected against diphtheria, but if it's been particularly more than 10 years, we're pretty vulnerable. If diphtheria arrived locally and started spreading around, we would want to have had a booster recently.
Yeah, of course, sort of like get ahead of the curve sort of thing.
Exactly.
Okay, great. Now, Claire, you mentioned it's happening, like diphtheria cases are happening elsewhere in Australia. Where in particular, like whereabouts in Australia?
Yeah, so at the moment it's occurring in the Northern Territory, so all of the Northern Territory, and also in the Kimberley, Pilbara and Goldfield regions of Western Australia, and also in the far northwest region of South Australia.
Oh, yeah, like the APY lands and that. Yeah, okay. Now, for the people in those areas, Claire, if they have managed to catch diphtheria, how do they go about getting treatment? What's the best way?
So the good thing about diphtheria is very easily treated with antibiotics. So it's just a matter of taking antibiotics. Usually people have the diagnosis confirmed by having a swab. So if you've got a sore throat, they might have a throat swab. If there's a skin sore, they'll have a swab of the skin sore. In the rare instance where people get that severe form, the throat or respiratory diphtheria, they may need to be treated in hospital and have additional extra care.
Okay, like a drip or just extra care, basically, like you said, yeah.
Something to treat the toxin.
Yeah, okay. And that's that the more extreme version, like you were saying, the membrane and... Yeah, okay. Oh, well, that's a good thing. Now, Jenny, I'll take this one up with you. For people in Victoria, should they be concerned? Is there anything like precautions or things we can do to be ready for if diphtheria comes our way?
Yeah, the main thing we can do to prevent diphtheria is to have the diphtheria vaccine. So our babies and young kids have the diphtheria vaccine in their program. So getting the scheduled immunisations on time is really critical. We get vaccines at 6 weeks of age, 4 months of age, 6 months of age. The vaccine we give at 18 months has got a booster that contains diphtheria as well. And the vaccine we give at school in year 7, that's also got a diphtheria booster. So at the same time, it's joined to the tetanus and the whooping cough vaccine. So
I was just about to ask about the whooping cough one, because some of us that might have had newborns in the family might have been asked to go get a whooping cough vaccination, so that covers diphtheria as well, does it?
Absolutely. So
Okay, great.
Some people locally who've recently had a diphtheria-containing vaccine because they got it for the whooping cough component. That's fantastic. I think there's probably 2 groups of people. If you're going to visit the areas where diphtheria is occurring, it's pretty important that you've had a recent diphtheria-containing vaccine, or whooping cough containing vaccine. And so you can pop into the ACCHO. The ACCHOs have got vaccine in the fridge ready to give people. And if you haven't had a vaccine for 5 years containing diphtheria, and you're going to those areas where diphtheria is occurring at the moment, I'd really strongly recommend go and get a vaccine booster. If you're living locally and not travelling to those areas, I think, check what your immunisation record is. And if you haven't had a booster for 10 years, I'd get a booster.
Yeah,
so
okay.
really, there's a bit of action that we do need to do. But, the main message is always get your routine vaccines on time anyway.
Yeah, of course. So is this, could I ask to get a diphtheria-containing immunisation whilst I'm getting my flu jab or something? Or is that sort of a...
Absolutely.
Huh?
That would be great. You could give my next flu vaccine talk for me, Josh.
Maybe.
I was talking to Auntie Jill Geller yesterday about flu vaccine. She's had her vaccine and she's out there recommending it to all her adult kids and friends and things. I think that there's a lot of flu spreading around at the moment.
Yeah.
We get used to just giving flu vaccine every year, and we forget that if you haven't had the vaccine in your arm, you're not protected. So you really need to go and recommend to people, go and get your flu vaccine. And you're quite right, you can have the diphtheria booster on the same visit as you get your flu vaccine. That's a great idea.
Yeah, great. Yeah, I personally, I get mine every year, my flu shot, especially since living in Victoria. It's bad enough, getting crook up north where it's hot and sweaty, but getting it down here in the middle of winter, it's no joke. So, yeah, I couldn't recommend it more, honestly.
I think also, Josh, in Melbourne, you're really more likely to get bad flu. We, go and sit indoors with the windows shut, and if someone's in the room who's got the early flu and they've got a runny nose and a sore throat, they're teeming with virus, and each cough and sneeze they do spreads around the room and you breathe it in and catch it. So it's a good reminder to go and get the vaccine, and also even just to think that if you are unwell, that's not the time to go and visit an elderly person.
Yeah, of course. Yeah. Yeah, if you're not feeling well, just stay home. Simple as that.
Yeah, and if you're not feeling well, you're catchy and you can spread it around. And I think that that's really, equally as important as getting the vaccine is trying to avoid sharing it with people who you try not to, share your germs with.
Yeah, I can just picture being at work and someone comes in with a bit of a sniffle and you do, stay away from me. But it's like, literally, stay away from me. Like, I don't need to catch whatever the hell you've got.
I think also this time of year, end of June, it starts to be the time where I've got some friends very sick with flu this week, and so it's prompted other friends to say, oh goodness, I've been meaning to get the flu vaccine, I haven't got it yet. So it's not too late to get it now. You can go and get it now. And in Melbourne, we tend to have 2 big peaks of flu. So we start at the beginning of the season, sort of May, June, and start to see a lot of flu happening. And then over the next few months, another second peak can occur. So don't think because you haven't caught it, at this time of year, that's not going to happen in a few months' time. And the vaccine you get now will protect you for a good few months and well worth having.
Yeah, well, it's good to know that, once you're going in for your regular shots, if you're worried about diphtheria, it is something you could ask for. Now, not to stray too far away from the topic, diphtheria chat we're having here, but just while we're talking about vaccines and immunisations, is there any other ones, Claire, like that we should be thinking about around winter or just in general that people might be forgetting?
Yeah, look, it's a really great question. This year there's been a new RSV vaccine that's become available for older persons. It's previously RSV vaccination. There's been a lot of really important changes in the last couple of years around pregnancy, vaccination, and vaccinating of babies. But this year, there's now an RSV vaccine that's available for people who are age 60 and above, so older people. The other one is COVID. It is still around. So the recommendations is for people aged 65 and above. And this is normally every year, could be every 6 months. There's a little bit more nuances.
Yeah, okay.
So it's one of those ones to definitely have a chat.
Yeah, ask. Yeah, if you're not sure, get some info, yeah.
It's interesting with the COVID vaccine. I think that sometimes people think because they've caught it a few times or they've had the vaccine that maybe they'll be protected.
Mm-hmm.
But really, your protection against COVID does not last very long at all. And I think that you want to feel like you're as protected as you can be next time you catch it. So I feel like, Auntie Jill Gallagher, I was chatting with her yesterday and she said she's had flu vaccine and the RSV vaccine and a recent COVID vaccine.
Yeah,
because
great.
It's important to be as well protected as you can be. The vaccines are made quite low strength to minimise side effects.
Yeah,
so they give you
okay.
good protection against severe disease. So I don't want people to think that if you go and catch mild COVID and you have the vaccine, it hasn't worked. It's worked really well because you haven't had a severe bout.
Yeah, of course. Okay, great. Now, Jenny, so I've had a couple of friends of mine in our friend group who've got a couple of newborns. Everyone's getting clucky. But just in regards to pregnant women and immunisations, is that something that women should be worried about or be thinking about?
Yeah, look, I think when you find out you're pregnant and you go for your first visit, it's worthwhile saying to the Aboriginal health practitioner or the GP, I'm pregnant, make sure I don't miss out on the vaccines. I've heard vaccines are important in pregnancy.
Mm-hmm.
We've learned a lot about vaccines in pregnancy and how much they can help the mum and help the mum stay well. The first one would be the flu vaccine. So when you're pregnant, you're actually pretty vulnerable to getting really bad flu. Unfortunately, your immune system's not quite as good when you're pregnant, so you can get a bigger version of the flu.
Yeah,
and also,
okay.
as you get more and more pregnant, you get bigger, there's not as much room in your lungs, and you can get a more severe disease. So you can get a flu vaccine any time in pregnancy. So anyone around at the moment that's pregnant hasn't had a flu vaccine yet, please go and ask at the VACCHO or
Yeah, okay.
the GP, get that. And while you're there, as Claire mentioned, the RSV vaccine. So RSV.
Now, just before we go further,
Yeah.
what does RSV stand for?
Yeah, okay. It's called respiratory syncytial virus. It's a vaccine. It's a virus that not many people have heard about because in the past we didn't used to test for it. So it just used to be one of those things. You get sick, you don't know what it is, you think it's some kind of flu or cold. And now we do testing for it. We've realised that a lot of those infections, those chest infections, are actually caused by a particular virus called RSV.
Okay.
And the virus is nasty when you're a tiny baby and when you're more elderly. They're the sort of times in life where it causes the most problem in your lungs. And the way we protect the baby is two ways. One way is we actually give the mum a vaccine in pregnancy, and the mum produces really good defence or really good immunity that goes through to the baby in the placenta, and the baby gets born with some protection. And the baby also, if the mum didn't get that RSV vaccine in pregnancy, there's actually an immunisation type thing that the baby can get as a newborn as well.
Okay.
So we've got a sort of double way of helping the babies not get really terrible RSV disease anymore, which is fantastic. I mean, the main vulnerability for babies, when you mentioned lots of your friends having kids, there's a lot of whooping cough in the community at the moment, and whooping cough is it's a very bad, it's a big bacteria, it spreads around from people coughing who've got...
Yeah, it's quite nasty, yeah.
Really nasty, and you're infectious for a long time, so you can be coughing away, being very generous, spreading the germ everywhere. And I think that we kind of sometimes underestimate how sinister the whooping cough germ can be. New babies get immunised at 6 weeks of age with their first vaccine, and then they get their next one at 4 months and 6 months. Once you've had that 6-month vaccine, you're really wonderfully protected. But even just after that first vaccine at 6 weeks of age, that's enough protection to stop babies dying. So getting that first vaccine on time is really
important, yeah.
And then even more, the mum can actually, during the pregnancy, get a whooping cough containing vaccine. And the good thing about that is if mum doesn't get that vaccine, the baby's born with no protection up until the 6 weeks. And when you give a vaccine during the pregnancy, then you get that birth. When you're born, you've got that lovely little bit of protection. So the window period of huge vulnerability is gone.
Yeah.
I had last week I caught up with a mum that I've met through my work. Her name's Catherine Hughes, She lives in Perth, and her son Royle died as a baby from whooping cough. And he, at the stage when she was pregnant, the vaccine wasn't part of the Australian schedule, and she didn't get a whooping cough vaccine in pregnancy. And her baby Royle caught whooping cough before he was old enough to have got that.
The first shot,
so when I saw her last week, it was just like a terrible reminder of how important prevention is. And I guess the main thing when we talk about immunisations is, and the main worry is people missing out on the opportunity to prevent. So we have these good vaccines, we have vaccine for flu, but it's only of use if you've actually had the vaccine in your arm. So people who haven't had the vaccines don't get that prevention.
Now, Claire, we were briefly touched on travel before, and different areas that are affected at the moment with diphtheria. If I've just come back from an area of concern, what should I be looking at for symptoms-wise? What if I feel fine as soon as I get back?
If you feel fine when you get back, there's nothing more you need to do. Probably for the next 7 days after you left, just keep an eye out for symptoms like a sore throat, fever, a swollen gland in the neck, because that might indicate that you might have throat or respiratory diphtheria, but it could be a whole lot of other things. It could be a whole lot of other viruses. So in that instance, if you were to develop those symptoms like a sore throat, pop in and see your clinic to see a GP or nurse, and make sure that you mention that you've been to an area that has had diphtheria. And they'll probably do a swab of the throat in that instance and send that to the lab, and we'll probably start you on some antibiotics as well, just to be sure.
I think it's a really good idea when you go to the clinic that you actually mention this is where I've just been travelling to, because people aren't really going to think about whether it
No, that's right,
So if community members can actually say, I've just been travelling up in the area, seeing family, and in that area there is some diphtheria, then doing that swab on your throat is really a very nifty idea at the time.
Yeah, absolutely, because you might just think, oh, it's winter, it's just a lurgy, it's fine, I'll have a couple of lozenges and, everything's sorted, but,
Just get it checked out.
Yeah.
Go in early. Don't sort of sit on it for too long.
Because that's the main thing too, right? Like earlier treatment is best. If you think you're a bit, or if you've been to an area that has it and you think you've got symptoms, just ask when you go to your VACCHO, ACCHO or your GP. Just say, hey, can I get checked?
Yeah, easiest just to get checked out as soon as you can. So the other place I think to keep in mind is skin sores. So if you have developed a lesion while you're away, or in that week or so after you come back, get that checked out as well. Or if you've got a cut or something that's become infected, get that checked out. And again,
it just doesn't seem to be healing as quickly as it should, or
and they'll just take a swab and send that to the lab and see what bacteria is causing it.
Okay, great. Now, obviously we're talking about diphtheria, but I hadn't heard of it in recent time. I think I heard it in passing on a news report or something, and I guess a lot of people wouldn't have heard of diphtheria. Is there any other, I don't want to say old viruses, but, is there other things that aren't present in people's minds that we should be thinking about, Yeah,
it's interesting. That kind of category of germ you're talking about is imported diseases.
Okay.
So these are diseases which we vaccinate against, which it's in case the germ comes here, in case a traveller comes back and brings it back, or if we travel overseas, so things like diphtheria and some other conditions like that as well.
Yeah, so the one that comes to mind straight away is measles. So measles is one of those diseases where we've been vaccinating really well in Australia for many years now. So we've eliminated measles. We've got a sort of badge of elimination that the World Health Organization gives us. But globally, other countries have had decreasing immunisation rates against measles.
I can think of one country comes to mind, but anyway.
No, you're right. It's the US, Canada, the UK, all across Southeast Asia. It really is a massive global problem at the moment, with a lot of cases occurring internationally. The risk to Australia is people when they travel overseas can catch measles overseas and then bring it back to Australia and then expose people in the community in Australia. Measles is one of those infections that is really contagious. So if you have 10 people in a room and none of them are immunised against measles, then 9 out of 10 will get measles.
Yeah, righto.
Contagious. And in Australia, we've sort of forgotten how bad a measles infection can be. Like, it's really bad for our kids. Kids aged less than 5 and then moving into the adult populations. And it's to the point a quarter of people get hospitalised with measles. They always feel, whenever I talk to them, they feel absolutely miserable. But the good thing with measles is it's a really effective vaccine, and it's been part of the childhood immunisation program for a long time now. In fact, people who were born before 1966, when there was measles still circulating in the community, are what we say naturally immune to measles, so they don't need to get vaccinated because they already have that immunity from having measles earlier on. And then a single dose of the measles vaccine was introduced in 1966. And then a second dose, a requirement for having 2 doses, was introduced in Australia in 1992. And that's important because we learned that actually 2 doses of the measles vaccine is required to get the best level of immunity.
Okay.
So there's a cohort of people, of adults, who were born between 1966 and 1992 who've probably only had 1 dose of measles vaccine, which at the time was part of the normal.
That was the norm, yeah.
Childhood schedule. So a lot of these people don't realise that actually they need to get a second dose, a second booster. And that's really important, particularly if you're about to go overseas, but even if you live in Australia, because we are getting so many people coming back with measles, you are potentially at risk of getting measles, and you really should get that second booster dose. So as you're coming in and getting a checkup for your flu and your diphtheria, it's a good opportunity to say, have I had 2 doses of measles vaccine?
Yeah,
and if not, you can get it the same day as well.
Well, get a one-stop shop.
One-stop shop. Yeah.
It's measles vaccine. It's like, it reminds me of one of the reasons why you make a vaccine, because the whole idea is to try and prevent severe illnesses. But different diseases are bad in different ways. So measles is one of the diseases that's bad because we really don't have treatment for it.
Okay.
So we're nice to people who get measles, who put them in hospital, but measles virus gets in and damages your lungs, damages your brain. Some people die, many people get terrible lung injury. It's an appalling infection, but we don't actually have any treatment for it.
Yeah.
And so it's right up there in terms of a disaster illness to get if you haven't had the vaccine. So that's sort of one of the reasons we make a vaccine is because we have no treatment. One of the other reasons we make a vaccine is actually to prevent some cancers. So a whole different reason for making a vaccine. So we have the hepatitis B vaccine, so it's a liver virus infection that when it's been living in your liver for a while can cause liver cancer. So that was the first vaccine in humans that can actually prevent a cancer.
Okay.
And then in recent years we've now got the HPV vaccine, the human papillomavirus vaccine, and that's an incredible cancer preventing vaccine. So it prevents cancer of the cervix, and in men it prevents cancer of the penis, and there's other genital cancers and oral cancers that can be caused by that virus. I guess that reminds me of the reason we want to make sure everyone knows about these vaccines is even if lots of people get vaccinated, they're worried about those that don't.
Yeah, of course, yeah.
And also maybe they've got really good questions about the vaccine that they want to understand more, or maybe they don't understand the disease well enough, and so going along to your ATCO or your GP and having your questions listened to is really important. I think that post-COVID, a lot of people would like more detail about immunisation.
Yeah, of course.
I quite like that. I think that people have got great questions about the diseases, and great questions about the vaccines, and sometimes some people like just a trusting recommendation. So some people I speak to, it's quite a short chat about HPV. When I explain it prevents cancer, they're really straight away wish they'd had it yesterday. But and other people want to know more detail, and so I think sharing detail with people is important. And also, when you go and talk to people about your vaccine questions, this whole approach of being very respectful and non-judgmental, I think, is really vital, because people have got really good questions and they want to understand the vaccines, and they want to understand the diseases. I think all immunisations are medications, and all medications have got side effects, even paracetamol and aspirin. So with vaccines, they're going to have some side effects, and what we do is, we really want to own the side effects and educate people about them, so people understand them and understand the disease.
that are afraid of the symptoms after getting a vaccine, or like, oh, that wasn't good for me, it made me feel unwell. It's like, but those are possible things that you get after the shot.
Exactly. And I think also, I mean, particularly something like feeling unwell after a shot, you don't want that to then put people having the next time. And flu vaccines are a really big example like that, because some people who are recommended flu vaccine, they might say, oh, I don't want to have that because last time it made me sick. And what I tend to do is ask about, well, when you last had the vaccine, what happened? And people will explain how they felt afterwards, and maybe they had a fever and had an aching arm, things like that. But if they describe that they also had like a runny nose or a cough or a sore throat, it's good to understand. I mean, that must have been awful. Imagine you're going to get a vaccine and now you've got a fever.
To prevent something, yeah.
You've got a cough and a sore throat and a runny nose. So I'm empathetic that happened to them. But the interesting thing is the vaccine can't cause a runny nose or a sore throat or a cough. So when someone's had that happen after the flu vaccine, we know quite clearly that they've caught an illness, so like an intercurrent.
It's an external thing. It's not something from the
And probably in some cases when they really did feel quite bad, they probably had the two things going on at once. They probably had some of the general side effects from the vaccine, like a fever and aching, and then on top of that they've got an infection. So I tend to say, well, how about you try it again this year, see how it goes. I mean, hopefully you won't catch something at the same time.
Yeah.
And then people often have the flu vaccine again, regain their confidence in it, and then end up being quite an educator about it.
Yeah.
Talk to people about it that actually I thought I got sick from the vaccine, but actually I think I caught something one year, but now I have it all the time.
Yeah, and it's like you mentioned before, like being trustworthy with your VACCHO. If a family member is confident in it and being like, hey, I'm your uncle. You haven't not listened to me before. I'm telling you, these are good. You get what I mean? Like, sort of went off track there a bit.
No, I agree. I mean, I think when family members explain about diseases we're trying to prevent and about vaccines, I think we really listen. And I'm keen to know. If someone tells me they got sick after a vaccine, I want to know that story. But then it's helpful to know the explanation behind what really happened. Things like that. Some of the community members are often the best educators about immunisations. A lot of the young adults are amazing at talking about HPV vaccine and making sure that their friends know about it and don't miss out on that. And you often have elders who are really good at promoting people to have flu vaccine, and often pregnant mums or partners and dads, they're very good at talking about whooping cough.
Yeah.
So become aware that it's
that's right.
big for the babies to not get that. I suppose we should also mention in newborn babies, it's not just whooping cough that we worry about. We worry about infections that cause meningitis. And meningitis is a name for infections that occur in the brain. We have a few different bacteria that cause them. One's called meningococcal, people might have heard of. One's called pneumococcal. There's another one called Haemophilus influenzae type B. Very boring names. But the point is these bacteria which babies until the age of 5 or at least till the age of 2, they've really got no good defence against these bacteria. And really the only way they can get a chance at not getting sick from them is with the vaccine. So when babies are born, the two main things I want them to get their vaccines in quickly are whooping cough and the meningitis vaccines. And meningitis, interestingly, we talked about like some diseases we immunise against because we don't have treatment, like measles. Some vaccines we immunise against to prevent cancer. Some vaccines we immunise against because we just think the disease is severe enough we want to prevent, like diphtheria. And then meningitis is another reason. We actually have really good treatment for meningitis. So we have a fridge full of specific antibiotics that we can give to a baby to treat meningitis. But the disease doesn't declare itself early enough for you to guarantee a good outcome. So when a baby gets meningitis, they become crashingly unwell between one feed and the next. So quickly. So they've just had one normal feed, by the next feed there may be a bit of a fever, not feeding so well, not quite right, end up going to the doctor or the hospital, and they're already crashingly sick. They can become deaf straight away. The infection's already got into the brain, causing brain injury. So the reason we use meningitis vaccines is because of the time problem. The disease doesn't declare itself early enough for us to get that treatment in. So I think meningitis vaccines are another really good one for families to know about and make sure the baby's up to date with that.
Yeah, as always, preventative is better than reaction, like better to stop it than try and treat it, yeah.
Absolutely.
Now, Claire, just back to the flu jab quickly before we move on. I've heard a rumour, well, not a rumour, but I've heard that there's possibly a spray getting around instead of the jab.
Yeah, so there's an intranasal or an up-the-nose flu vaccine that is available for the first time in Australia for kids aged between 2 and 17 years. However, this has been used for many, many years in the Northern Hemisphere, particularly in the UK, where it's part of their school-based program. So kids every year get a vaccine against the flu up the nose. And the kids really love it. And so the parents just, you don't have
no scary needles. Yeah, you don't have to pin a child down and...
Just a spray each nose and breathe in. And it's really well tolerated. You can get a bit of a blocked nose, a bit of a headache, but nothing too major. So that's just as safe as the usual flu vaccine and also just as effective. So it works just as well.
Yeah, that's the main thing, yeah.
So, but in Australia it is available but not funded.
Okay.
So in Victoria it's not free, available for free. However, you can just go to your local pharmacist and they're able to give it to your child for a small fee, or to see your GP. They might have it available.
So the option's there. So yeah, it's not funded, but if you're having a hard time every year getting your young one to sit still for the jab, yeah, you can at least, this is an option that's available. Yeah, okay, that's great.
And we're hoping that next year in Victoria, the nasal spray flu vaccine might be available. So in Western Australia, they've started with it fully in their school program this year. And I think, not as many kids get flu vaccine as we might think or might want, because young kids up to the age of 5 can get really serious flu, and they can end up in hospital with bad flu, and it's a really vital age to try and help those kids get the flu vaccine. And kids at school age can get flu, but they also can spread it with their community members or with your elder. And I think that, we've been learning from information from the UK who've been using the nasal spray that not only did they get less kids getting sick themselves from having the flu vaccine, they've actually seen less flu occurring in the older people. So it's a dramatic difference. So it's got a sort of direct protection on the kids themselves, and also an indirect protection by spreading it around less when you get home. So that's
not sharing it to the grannies when they go for visits, and it's great. It's like a bonus add-on effect of the spray.
It's awkward this year having a new vaccine that's registered, so recommended but not funded. I don't like that situation. We have that with some vaccines sometimes, and we're hoping the time period where it's only available by purchase will be short, and we're hoping that Victoria will do that next year.
So is that like just a demand thing, you think? Like because it's kind of new and that's why it's not funded, or we just wait until it does its course? But you said it's in the UK for ages now, so...
It was the vaccine up the nose wasn't registered in Australia for all those years. It was registered in Northern Hemisphere, so we didn't have it as an option to use.
Okay.
It's just recently been registered, and some of the states are being really proactive and straight away have put it onto their program. So Western Australia are really proactive with the flu vaccine program they've got in children. They're kind of leading the way, and so we're learning from them, and I think we're adopting what they're doing. Hopefully we might do that in Victoria next year.
Good to know. Okay, now doctors, we've had a good run here on vaccines of all sorts of varieties, sprays, jabs. Before we get back to the topic, diphtheria, trying to share some information about that. Is there any in particular that you think people should get that people aren't getting, or don't even think to get?
Well, when I talked to Auntie Jill Gallagher yesterday, she said, don't forget to mention the shingles vaccine.
Oh, yeah, of course.
So when we're young, we catch chickenpox. And the chickenpox virus is what actually causes shingles in later life. So as a young kid, you can now get the chickenpox vaccine, which is fantastic. But your protection against chickenpox reduces with time. And the virus, when you've had chickenpox, goes and lives in your body along near the spinal cord at the back. And it can come out at various times during the body as a patch. And so you might know someone's had a big cluster of sores on their face called shingles on their face, or a big patch of it on their chest. And shingles is a horrendously painful condition. Many people have the condition for months and months and have pain associated for months and months. And there's a terrific vaccine available which, can stop you getting shingles at all, but definitely makes you get a much milder version of it when you're going to get shingles. So I think it's one of those vaccines that people really underestimate how important it is until they meet someone who's then got shingles, and who, when you probably don't ask them then, how come you didn't go and get the vaccine? But it's just a good time to remind it. And from 50 years of age, Aboriginal Torres Strait Islander people can go and get their shingles vaccine. And also, we're now learning from some international work that at a community level and a whole of country level, people who've had shingles vaccine are less likely to get dementia. So it's one of those indirect terrific benefits you can get from a vaccine. We're still learning all about that, but I just think that you can talk about that more with your VACCHO staff, but it's you have the direct benefit that if you get shingles vaccine, you reduce the chance of getting that shingles yourself, but also it can have an impact on reducing dementia, which is amazing.
Yeah, absolutely. That's incredible. Well, doctors, that's just about all the time we've got for today, unfortunately. But Claire, would you like to give us a bit of a recap on the diphtheria? What is it? What should we be looking out for? Things like that?
Yeah, sure. So diphtheria is a bacterial infection which can cause a throat or respiratory infection. So you can get symptoms of a sore throat, fever, swollen neck glands. It can also cause skin infections, so skin sores or infected wounds. There's a more severe form of respiratory diphtheria, which we rarely see in people who haven't been vaccinated or have had boosters a long time ago. And it's currently a big problem across all of Northern Territory, the Kimberley, Pilbara and Goldfield regions of Western Australia, and far northwestern in South Australia, so the APY.
Yeah, APY, yep.
Lands. So we're really just asking people if they haven't had a booster against a vaccine against diphtheria in the last 10 years, it's a good idea to have one to keep that protection really strong in Victoria. And for people who are travelling to those areas that I mentioned, and if they haven't had a booster in the last 5 years, so that shorter period, should pop in to their local VACCHO and get a vaccine before they go. People who are returning from those areas for the week after they come back just need to keep an eye out for things like a sore throat or fever and swollen neck glands, which could be lots of things. So in that instance, go see your local VACCHO. Like don't just assume that I just got a cold coming on. If you've been to those areas, best safe than sorry. Yeah. Definitely. And same if you have a skin been checked out.
Yeah, and then with the whole booster thing, as a rule, if I can't remember the last time I got a shot, I'm probably due to go get a booster. Is that basically? That's a good. Yeah. Okay.
I think at the VACCHO, the staff can really clarify that with the Aboriginal health practitioners, Aboriginal health workers, nurses and doctors. They can look up what immunisations you've had on the immunisation register. The diphtheria booster in adults is given joined to whooping cough and tetanus. So some people may have had a recent booster, which they had as part of a whooping cough vaccine.
Yeah.
So they'll be able to check that. And if you are going to talk about immunisations, as you mentioned, Josh, go and ask about flu vaccine and other vaccines you might be due. And if you've got any questions about it all, you'll be really respectfully listened to and get all the detail you need so you feel really comfortable preventing.
Yeah, that's it. If you're not sure, just ask. I know all my experiences going into VACCHOs, patient people. If you've got a question, they're happy to answer it for you.
Absolutely.
Yeah, that's great. Well, okay, you mob. That just about wraps up our chat for today. Our health yarn with NEPHU. I'd like to thank Dr. Jenny Royle and Dr. Claire Gordon for coming in today. It's been very informative, and and thank you for your time. And if people wanted to learn more or look up some more information themselves, where best do you think they could go?
I think pop into your local VACCHO would be the best place to go. And if you've got a GP clinic that you attend separate to an VACCHO, go and ask them. I think people are really interested to answer your questions about this sort of stuff, and everyone's learning about diphtheria. Thanks.
Anything to add there, Dr. Claire?
No, I think that's covered it really nicely.
All right. Well, once again, thanks for coming in. And this concludes 3K&D and NEPHU Health Chat. And that brings us to the end of our segment regarding diphtheria in partnership with NEPHU or North Eastern Public Health Unit. Today's program was recorded and produced on the Wurundjeri Woiwurrung country and we acknowledge the continued unceded connection to lands and waters. We hope you've enjoyed today's program. If you have any burning questions or thoughts sparked by today's discussion, we encourage you to reach out to your local health professional and yarn within your community. I'd like to give a big thanks to NEPHU for making this program possible, and thanks of course to all you listeners for joining us, and I hope you've enjoyed it. This episode will be available as a podcast on 3KND and NEPHU's social channels shortly if you wanted to share it with someone or if you want to listen back to it later. 3KND, keeping our community connected.